Hello and welcome to the Pace Hospitals podcast. Today we're diving into a common but often overlooked health condition that is anemia. It occurs when the blood does not have enough healthy red blood cells or hemoglobin to adequately carry oxygen throughout the body. Depending on its cause and severity, anemia can lead to fatigue, weakness, breathlessness, dizziness, and other symptoms. Joining us today is Dr. Snigdha Panuganti, General Physician at Pace Hospitals, who has wide expertise in diagnosing and managing anemia and related blood disorders. In this episode, the doctor will share valuable insights on anemia, including its symptoms, common causes, risk factors, diagnosis, treatment options, and the role of diet and nutrition in its management. Dr. Snigdha Panuganti, thank you for joining us at Pace Hospitals, High Tech City. Let's start by understanding what is anemia.
Hello everyone, I'm Dr. Snigdha Panuganti, Consultant General Physician and Diabetologist working at Pace Hospitals, High Tech City. Today I'll talk about a topic called anemia. Anemia means your red blood cell content is low or your hemoglobin is low. Anemia is very common in Indian females. 50% of the females in India are suffering with anemia. Yet it is the most ignored problem. In our red blood cells, we have a protein called hemoglobin. When the hemoglobin is less, we call it anemia. Hemoglobin is important because it carries oxygen from the lungs to all the tissues in our body. When hemoglobin is deficient, oxygen supply to all the tissues will be reduced and it causes problems, which are all the symptoms of anemia.
So, doctor, what are the causes for anemia?
There are several reasons why a person can develop anemia, but worldwide, the most common cause is iron deficiency. Iron is very important for production, for the manufacturing of red blood cells. So, red blood cells are produced in the bone marrow by utilizing iron. But if your diet has poor iron or if you are losing lot of blood during your monthly menstrual bleeding or losing blood through intestines, like if you suffer with piles or hemorrhoids, you are losing blood every time you pass the stools, then all these are the reasons for loss of blood, which also is loss of iron, and you are not repleting the iron levels in your body by taking enough diet. Then you develop iron deficiency anemia. This is the most common cause. And the second is another vitamin like vitamin B12 and folate. Vitamin B12 is mainly present in animal food. If you are a pure vegetarian who doesn't consume any animal products, then you are likely to develop vitamin B12 deficiency. You need to be on vitamin B12 supplements. Other causes of anemia are if you are suffering with long-term medical conditions like kidney problem, you are under kidney dialysis, chronic liver problem, which can develop because secondary to alcohol intake or any hepatitis, and you are suffering with cancers. You are on chemotherapy drugs, which is a treatment for cancer. All this can also contribute to development of anemia. Certain bone marrow problems can also cause anemia because bone marrow is a place where this hemoglobin or RBCs are produced. If there is any problem in the bone marrow, the amount of hemoglobin produced will be less. There are other conditions called hemolytic anemia, where your own body, WBC, will attack the red blood cells and it will reduce the number of red blood cells and it presents as anemia. So these are all the causes of anemia. So anemia is just not a single disease, but anemia will point us to some other major problem. It could be blood loss, it could be chronic kidney disease, it could be liver disease, or it could be cancer. So proper evaluation of anemia is important to find out the underlying cause for the anemia.
Can you explain what are the symptoms of anemia?
If you have anemia, how do you feel? What symptoms does the body produce that indicates you are suffering with anemia? Mainly, the most important symptom is fatigue, tiredness. Even regular daily activities can feel very exhausting for you. You feel very irritable, low concentration, and when you climb the stairs, you feel tired, short of breath, and you take long, deep breaths to climb the stairs. and even walking long distance can feel very difficult. You will have pale face, and nails also become very pale, and your hands and feet can feel very cold and poor concentration. All this can be seen if you have less hemoglobin, because lack of hemoglobin means less supply of oxygen to all the tissues, and all the symptoms this presents like this.
Dr. Snigdha Panuganti, how is anemia diagnosed?
When a patient comes to me with these symptoms of fatigue, tiredness, and low concentration, hair fall, shortness of breath, I examine the patient. I look for the nails. Is there paleness in their nails? And I look at the lower conjunctiva. Is it pale or is it red? If it is pale, it is an indicator that she or he has less hemoglobin. And based on the clinical suspicion, I order few investigations. The most important one is complete blood picture, where I look at the hemoglobin value. And if the hemoglobin value, as we spoke in the earlier video, in females, if it is less than 12 grams per deciliter, or in males, if it is less than 13 grams per deciliter, we call it as anemia. So it doesn't just end here. We identified anemia, but we have to identify what is the cause for anemia. Is the patient losing lot of blood during the menstrual cycle? Is her diet deficient of iron? Or is he bleeding from intestines, or passing black color stools, or suffering with hemorrhoids? I evaluate for all these conditions. Also, I order few other investigations like iron profile to see how much iron is there in her body, vitamin B12 to check her kidney and liver functions to make sure they are appropriate or not. Based on this, I come to a conclusion that anemia is caused because of so and so problem. So now I will treat not just anemia but also the underlying problem.
Could you explain what are the treatment options for anemia?
Once anemia is identified, we evaluate the cause for anemia, that is either iron deficiency, vitamin B12 deficiency, or underlying medical problem, or are you losing blood because of heavy menstrual bleeding or losing blood in the intestines. Based on the problem, we usually go with the treatment options. If you are iron deficient, we give iron tablets or iron in the form of syrup or iron as an injection based on the requirement. Vitamin B12 tablets can also be given if you are deficient. If it is due to heavy menstrual bleeding, we should evaluate why you are bleeding heavy during the menstrual cycles. Is the thyroid function test normal? And is any fibroids in your uterus? So we treat accordingly. In males, especially males who are above 50 years, in males, developing anemia is very unusual. It is always indicating something abnormal within you. So we always do endoscopy or colonoscopy, which is camera test, passing a camera down your throat to see inside your stomach and also to see inside your intestines to make sure you're not bleeding anywhere in your intestines, because anemia in men is always an indicator of a major underlying problem. So, in an elderly male, anemia is evaluated more thoroughly by doing all the endoscopy evaluation and looking for if there is any other underlying kidney problem, liver problem, or any malignancy. So, these are the changes, these are the treatment options which we have. And also, we also suggest mainly diet changes. Important is increase intake of iron rich and vitamin B12 foods.
So, doctor, what are the dietary options to improve blood health?
Because iron deficiency is the most common cause of anemia, improving your diet and taking enough iron rich food is very important. Iron in the form of animal food is easily absorbed and it is more rich in iron. Animal food like egg, chicken, mutton, liver, and fish, these are all very high rich in iron levels. If we consider the vegetarian diet, we have all the pulses and lentils, moong dal, tur dal, green peas, chickpeas, rajma. All these are very rich in iron. Including these into our daily diet, like with rice, we have dal and rajma. This is enough for your improving your iron levels. And we go at the leafy vegetables, we have spinach, amaranth, all these are important. And when we look at the nuts, we have pumpkin seeds, sunflower seeds, sesame seeds. All this, if you add into your diet, 1 spoon each day is much better. Also, for better absorption of iron rich foods in your intestine, we have to include vitamin C rich food into your diet, which is like lemon, oranges. These help in better absorption of iron. Also, in people in whom we give iron supplements, we also give vitamin C tablets because it improves iron absorption. For vitamin B12, you can have animal food, but if you are vegetarian, it is better you take vitamin B12 supplements.
Dr. Snigdha Panuganti, one final question. Can anemia be prevented?
Yes, the most common form of anemia, iron deficiency anemia in young reproductive age females, is mainly due to lack of proper nutrition. So, if you are planning pregnancy, or if you are feeling tired weak every day, and if you think it is because you are not having enough healthy diet, then make changes to your diet. Include all the iron rich foods into your diet. And if you are having heavy menstrual bleeding, please consult a doctor and get evaluated why you are bleeding heavy, because controlling your bleeding is the first step we can do to prevent you from developing anemia. And in male who have weight loss and feeling tired and also have recent change in bowel movement, then you have to get evaluated, because in elderly male, anemia along with change in bowel habits indicate a major problem, so it should be evaluated. If you do these changes, most of the most common type of anemia can be prevented. But if your anemia is because of genetic reasons, then it is difficult to prevent, but it will be managed when you are under care with a proper doctor and follow regular follow-ups. Thank you.
Thank you, Dr. Snigdha Panuganti, for sharing crucial information about anemia with our listeners. I hope this information helps our listeners better understand anemia, its common causes, symptoms, diagnosis, treatment options, and the importance of a balanced diet. Recognizing anemia early and addressing its underlying cause can help prevent complications and improve overall health and well being. If you have concerns about persistent fatigue, weakness, dizziness, breathlessness, or other symptoms of anemia, don't hesitate to consult a general physician for proper evaluation and treatment. We will see you soon with another informative episode on the Pace Hospitals podcast. Until next time, stay informed and take care of your health. Thank you.